So just back to a couple of quick questions, and maybe we'll just kind of take this to more of an open discussion. Dr. Metzger pointed out early in the discussion, it's all about positioning and timing. So as you think about the carotid space over the next year or two, relative to reimbursement, other things that are happening with technology platforms coming to market, the continued evolution of TCAR as an application, including our device and other things, how do you think about how this transition from surgery to endovascular care looks, in the short term, medium term, and is this finally going to be that moment where everybody's expectations are met and we don't have to put a chart up anymore that says all the other vascular areas have migrated from surgery to endovascular with the exception of carotids? How does that feel from that perspective? And then maybe Tom can share some points of view of how things really operate in Europe in a European perspective. But
I'll start just because we're going around this way, but I think it's a nice spot, certainly for CGuard and some of the others, because of the stagnation which we already talked about. The companies that have carotid stents right now are old technology. You think about the Acunet, for example. I haven't used one in 15 years. They're still around. We have just a couple stents, and there are a couple relatively decent stents, but even some of the bigger players have old stents that none of us like and none of us use. Okay, won't name them, but they're there. So now, moving forward to a time of reimbursement opening, it is an awful good time to have a new stent with new technology, some of the features that we've just talked about that give you conformability and coverage, and the results that will be, I predict, as good as anything we've ever seen. So it's a very exciting time. I think, quite honestly, Marvin, for Inspire MD and for folks, just because you're in that house of having all those things in competing against stents that are 20 years old and haven't changed in 20 years. And if your stent plays well, no matter how you get there, whether it's from the TCAR approach, fine. Put the best stent with the TCAR if it's best. If it's from transfemoral, transradial, doesn't matter. You can get the stent, you have a stent that works. I think it's an exciting time for those. And I think some of the big companies are going to be scrambling to get back in the game, would be Chris's prediction.
I like that.
I agree. I mean, there's some big strategics who spend a lot of time in investment space and do not have a product in the space right now and have not. But as we talked about, if you decided to start creating a technology again today and nobody's improved stent technology, there's not been a new stent on the market since I can't remember when. To start, it's 3 to 5 years at best, and hundreds of millions of dollars. And so, you're going to have a new stent with new data. It's a new platform. It delivers something new. All of a sudden, when there's going to be a rapid rise in demand, and I think that's a great time to sit there and be there where you can stand alone. I'm sure there will be plenty of big strategics coming to talk to Inspire MD to sit there and say, well, hey, we missed out. We've waited too long because we weren't sure what's going to happen. But, I really feel that, with the 10-year data being so strong, showing that if you choose the anatomy appropriately, you can have excellent outcomes with whatever approach it is, whether it's endarterectomy, medical management, TCAR, or transfemoral setting. And I think we're starting to see that. I think, one of the issues we have with stenting is calcium, and we're seeing therapies now we use in other areas of the body for calcium. I think we're going to see a rapid rise in investment in the carotid space to help not just what we know we can treat well today, but hopefully to start tackling some of the lesions where we know that, the current stent portfolio doesn't work well in a densely calcified lesion because we can't get the calcium to yield. And I think we'll see therapies that might start getting adopted that may help that actually broaden the amount of patient population that have equipoise in their choices. You'd say, okay, you would definitely do surgery now. And you can say, all right, now if I can address getting the calcium where it will yield, now it's a patient choice. It's patient-centered decision-making.
So in general, the carotid narrative becomes important across the board. That's kind of the message is you have to be at the right place at the right time, as you said, and make those investments.
As the older guy here, I can say the population is not getting any younger. And it actually is aging. And to that point, to Sean's point about it's aging with more calcific plaque and more challenging plaque. And I think we need the technologies like this to be able to manage those kinds of complicated patients.
Right.
I constantly am impressed by some of the stents that you all have put in Europe, and looking at Piotr, for example, and some of those lesions look so ugly and they came out beautifully with this stent, which you wouldn't do. I mean, so I think this stent is an enabler to allow you to treat patients who might not otherwise have been treatable. And to Adnan's point, that includes the recently fresh clot, things like that. We have to do develop the evidence base for that, but I believe that the covering will actually facilitate and protect the brain, as you said, even better